Today's webinar will be presented by Ms. Julie Tracy and Ms. Abbey Karin. Julie Tracy has been working as an exercise physiologist for over 5 years. She graduated from Northeastern University with a master's in clinical exercise physiology and recently became a certified health coach through ACE Fitness. Her team runs the invasive cardiopulmonary testing lab to help diagnose unexplained shortness of breath. In addition, they perform non-invasive testing, which is where they see most of their pulmonary hypertension patients. When not planning exercise programs for her patients, Julie spends a lot of her time riding and racing bicycles. Cheez-Its are her favorite bicycle ride snack. Ms. Abbey Karin graduated from the University of Virginia in 2013 with a BS in kinesiology and in 2014 with a master's in education in exercise physiology. She has been a senior exercise physiologist at Brigham and Women's Hospital for almost 3 years and works primarily with the Pulmonary Vascular Disease Program, doing invasive and non-invasive cardiopulmonary exercise testing. Along with that, Ms. Karin provides exercise prescriptions for her pulmonary hypertension patients, along with other patients that come through their dyspnea center. At the University of Virginia, she was a member of the track and field team, where she threw the javelin. Currently, Ms. Karin enjoys doing triathlons, running 10Ks, and listening to Beyonce.
Well, thanks for having us, first of all. We're really excited about giving this webinar. And so, firstly, we just wanted to say, in the last few decades, treatment has really changed for the better for pulmonary hypertension patients. There are more and more options now. And before these options, the PH patients were actually told to avoid exercise. And nowadays, though, that the treatment options are so much better, exercise is actually proving to be very beneficial. But before we begin, we wanted you to be aware that you should always consult your doctor before changing or starting an exercise program. So very important. All right, so first, why exercise? So I wanted to go over the many benefits of exercise. So first, you'll get an increase in your exercise capacity, which is your VO2 and endurance. And VO2 is the body's ability to take up oxygen and use it in the working muscles. It'll also improve your resting heart rate, which means that your heart is more efficient when pumping blood. It'll create a really great support team. Having a friend or a group to motivate you to exercise will really help bring this to be a lifelong thing to exercise forever, and it'll be beneficial. And also exercising with more people is also more fun and social. It improves your WHO functional class. It also improves your skeletal muscle function and increases your bone density. It decreases your blood pressure. It improves balance. No one likes to fall, especially during those winter days and the colder days. It decreases fatigue, decreases your inflammatory response. It also helps a lot with stress management. It increases the endorphins, the good feelings, mood improvement, and better sleep. It increases your self-confidence, decreases in depression and anxiety, and all of these things will improve quality of life. And basically, your everyday activities will become a lot easier. And also, these benefits will also help prevent other chronic diseases as well. And so with benefits, there's also risks. And it's important for you to know these risks and so that you can recognize and help prevent them. And so this includes shortness of breath, dizziness, chest pain, pre-syncope, which is just that feeling right before you pass out, sudden cardiac death, and injury. And some of those sound very scary, but keep in mind that these risks are actually very low for pulmonary hypertension patients if you keep your exercise intensity low to moderate. And so to prevent some of these risks, there's a lot of red flags that you can look for. And this is when to stop exercising. So this will be feelings of pain or pressure in the center of the chest, nausea, discomfort in the neck or back, and extreme difficulty in breathing, unusual shortness of breath, sharp or severe joint and muscle pain. This could be a sign of injury. Soreness is normal, though, after a day or two after exercise. Dizziness or the feeling of passing out, or if you have access to a blood pressure cuff, a drop in blood pressure. And recognizing these risks will really decrease the potential for having, the severe shortness of breath, the chest pain, the presyncope, and all that stuff I just talked about before. And a really good tip is actually to exercise with another person. Sometimes another person might recognize these changes before you do. And another way to decrease your risk is actually to know how to monitor yourself properly. And there's a few different ways you can do that. The first one is heart rate monitor. So you can get a heart rate monitor. Some people have an iWatch, some people have a Fitbit. You can get a little fancier, you can get a polar heart rate monitor with a chest strap. And with this, you can actually keep your heart rate in the desired range that your physician or exercise physiologist prescribes to you. And that might be good for certain people kind of really like numbers and data. And here at the Brigham, we actually do cardiopulmonary exercise testing where we can actually provide these heart rate zones. And the second one, oxygen saturation. So some of you might actually already have oxygen saturation, the pulse oximeter, and so it's good and important to use supplemental oxygen or take a rest when your oxygen drops below 90. And this number is actually pretty conservative. Some people might say 88, some people might say 87, but it's important to actually ask your personal pulmonary doctor what he or she prefers before you start your exercise program. And then the last one is know your rate of perceived exertion. So this is the RPE scale, and it's a scale from 0 to 10, 0 being nothing at all, rest, and then 10 being kind of that maximal exertion. So a few high-risk activities. So these are some things that you should probably try to avoid. So high intensity or extremely strenuous activities. And also avoid full immersion in water due to increase in interthoracic pressure. And again, please consult your doctor if you have any questions. And then traveling to high altitudes is a tricky one because everyone's disease is a little bit different. So be sure to ask your doctor if the altitude you're traveling to is appropriate for your disease. And then an example of an extremely strenuous activity that you should actually avoid is shoveling heavy, wet snow. Here in Boston, we have a lot of snow, so it's a good excuse to let somebody else do it for you. And this can cause a sudden increase in heart rate and blood pressure. And so get fit. So FIT stands for frequency, intensity, time, and type. And I wanted to just make sure that everyone knows that these recommendations are very basic recommendations. And if you have any questions, again, consult your doctor. These are, a good starting point. And frequency, so this is a goal of 3 to 5 days a week of aerobic exercise, and 2 to 3 days a week of strength training and stretching and balance exercises a little bit every day. Intensity, you'll want to start at lower intensity if you're just starting out. So that would be RPE of 2 to 3, and also advanced is tolerated. And actually, we had a good question about intensity, about terrain and intensity, actually. And somebody was talking about if sand was more difficult, if that can increase your intensity. So flat ground is obviously the easiest. Dirt might actually be a little bit better on your knees, but sand and uneven ground can actually increase the intensity, and you might actually start to feel like your RPE is going up a little bit. So you want to be careful depending on where you are. Like if you're going hiking, it might be a little rocky or steep, and so you might be feeling like you're going at the same pace, but it might actually be a lot more difficult. So just be aware and diligent to monitor yourself to make sure that you're not going too hard. And then time. So this is just a goal, and this is a good starting point. So a goal of 30 minutes a day, and this can be 30 minutes straight. It can be broken up to 10, 10, and 10. You can do a little in the morning, a little bit at night, whatever works with your schedule and with what you're doing at the moment. And then once you get to 30 minutes a day, you can gradually increase that to 40, 45 to an hour. It really depends on the degree of your disease and how much exercise you've done in the past. And then the last part here, type. So aerobic exercise, that can be bicycle, it can be treadmill, walking, elliptical, but the most important thing, it should be something that you prefer and that you enjoy so that you'll do it for a very long time. And also strength training, so functional exercises, free weights, gym machines, balance and flexibility exercises.
All right, so now that you're deciding to start your exercise routine, remember to start slow. A lot of times you turn on the TV and you see these weight loss shows and they all of a sudden make people start sprinting on a treadmill. Please don't do that. This is advice even if you don't have pulmonary hypertension. So you should never start off that quick. But it's even more true for people with PH. Now, we want you to start, say you're just sedentary, you're not doing much exercise, start off with 3 days a week of aerobic exercise. So aerobic being, think cardio. Like Julie said, these are biking, walking, etc. So these workouts should increase your heart rate and breathing to a maintainable rate. Oops, sorry about that. Let me go back. So you start with 3 bouts of 5 minutes of walking. So what we mean by bouts is like Julie said. You start walking for 5 minutes and then take a break. Get your breathing under control, get your heart rate under control, make sure you get back to baseline, start again, another 5 minutes. You know, and I like to do this, think of somewhere that you can walk with benches. If anybody has done the PH walks across the country, I know we did one here in Boston and it was great. We were around this park and it had tons of benches. That's going to be somewhere that you want to exercise. I also recommend a mall. Malls have plenty of places to sit along the way, so you're never struggling on where to take a break. And this should be between RPE 1 and 3. So if you look over to the right of the screen, you're going to see the rating, the Borg rating scale. 0 is you sitting on the couch doing absolutely nothing, and 10 is the hardest thing you've ever done in your life. You need to start off in the 1 to 3 category. You're new to this. This is a lifestyle change, not just a quick sprint, not just training for one thing. We don't want you sore the next day or get completely short of breath and say, I never want to do this again. And like Julie said before too, just reiterating, find a walking partner. This is good for safety, but also to tell about your intensity. So what I usually tell people is that when you're looking at an RPE of 1 to 3, think about having a full conversation with someone. This should be easy enough that you're able to just talk to the person next to you, have full, long conversations, and not feel like you're winded. If you're struggling to get a couple words out, then that's when you're going too hard. So say you've been exercising, say you've been walking for a little bit. Try increasing your time. So maybe try about 2 bouts of 15 minutes. And you can start that, I said 5 days a week here, but start it at 3 days a week and then work up from there. Remembering that the goal is 30 minutes of continuous exercise. Now, because you're doing this longer, it's going to be a little bit more difficult. So your RPEs are going to be from 2 to 3. Even into the 4 to 5 range is okay once you've been exercising for a good long period of time. Now, this is going to be, if you're saying you're having that conversation with someone, you're able to talk to them with a full sentence, but maybe you don't want to tell them everything that's happened to you in the past month. You want to just be like, hey, Julie, how's it going? And then continue on working on your breathing and walking. So in terms of looking to do this 30 minutes of exercise, so you can switch between walking, biking, or elliptical. So it's good to see what your local gym has to offer. A lot of YMCAs have a lot of different, and other gyms have a lot of different machines that would be good and fall under that aerobic exercise. So make sure, like always, take a good rest in between your bouts of exercise. Check your heart rate if you have one, your pulse ox if you have one. Make sure everything's, once again, back down to baseline. If you have a buddy that you're exercising with, check with them. Be like, you think we're good to go? You think we're good for this next bout? Just so you guys are both on the same page. When you're thinking about increasing intensity, when you're thinking about, all right, I've done mine now up to 2 bouts 15, I think I can walk faster. Don't change the amount of time at the same time you increase the intensity. when you want to try to see if you can walk faster or even jog or whatever that may be, don't change the time. You want to make sure that your body can handle that and that you're ready to go the next day for walking. So just remember that. So high intensity interval training. I think anytime that you go on the internet, you see this as being a possibility for exercise. There isn't much research on the benefits of high-intensity interval training with patients for pulmonary hypertension. I did come across a research paper that was in rat models with PH, but it was very preliminary results. So things to be aware of. Please only do this in a well-supervised area. What I mean by that is someone with an exercise physiologist, a personal trainer, or in a cardiac or pulmonary rehab facility. Start slowly. Concentrate on your breathing. If you feel lightheaded or dizzy, you have done too much. And like we keep reiterating, please consult your doctor. High-intensity exercise is a risk for anybody to start doing, and that, especially with pulmonary hypertension, there are additional risks. So now we're going to go into strength exercises. Now, we're not trying to form bodybuilders here. We're glad to answer those questions too after if you have any questions about, more strength exercises. But the exercises that we'll go over here are more for functional movements. So strength exercises help preserve strength, independence, and energy. They reduce signs and symptoms of many diseases such as arthritis, diabetes, osteoporosis, heart disease, obesity, and back pain. And these should only be done 2 to 3 times a week. These should not be done every day. You need your muscles to be able to heal, rebuild before doing another day. So let's talk about safety. It's important to use smooth, steady movements. Don't, jerk your back all the way back. Nice, steady movements, no matter if you're doing leg exercises or arm exercises. You should have a chair or person nearby to hold on to, not a chair with wheels. Seen it before. Maybe in front of a couch is a great spot. It's a nice, sturdy chair. Make sure you don't hold your breath. So think about the same thing Julie talked about with shoveling snow. A lot of us have that tendency when we're picking up something super heavy to hold our breath, bear down. That's unsafe for anyone, especially with people with PH. It will increase the pressures. So just be mindful of your breathing. And start with light weights or body weights. Many stores like TJ Maxx have pretty cheap light weights. Also, if you don't feel like buying them, find stuff around the house. Cans of soup to start is great. There are different sizes and weights of those, so just be mindful of that. So first example, chair squats. And if we look at our fabulous cartoon, she's doing a great job. Start with the recommendation 3 sets of 10. That being said, if you find yourself that you've never done any sort of strength exercises before, starting with 3 sets of 5 is just fine. So you want to stand in front of a chair or couch, sit down till you're approximately 90 degrees, so just as it touches your butt, you kind of bounce back up, nice and easy and steady. She's using a nice chair, but I personally think it's great to do this in front of your TV, near your couch. Commercial breaks, during TV episodes, you can start to do this. And if you fall back into your couch, which is probably where you start in the first place. So it's safety first, making sure that chair is sturdy. All right, so now we're going to go angel wings. So like I said, 3 by 3 sets of 10, but 3 sets of 5 is just fine. Use the dumbbells or the cans of soup. Hold the dumbbells in both arms. Lift the arms laterally up to shoulder level. You can pause there for a second and then slowly bring them back down. And if this is hurting your shoulders, feel free to do this with your thumbs up. That sometimes will have less impact than impinging anything in your shoulders. All right, another one is bicep curl to overhead. And if you want to start with just doing this one arm and then another arm, that's fine too. But what you do is you hold the dumbbell in each hand, facing your arms forward, palms facing forward, bend the arms 90 degrees of flexion, rotate the arms, palms up, and push the weight overhead and back down nice and slowly. Actually, the person here is doing a fantastic job. So if you just think about combining those two, that would be perfect. And like I said before, drop them down nice and slowly. Don't just fling them over to the side. All right, another one, wall push-ups. These are great. If you've already graduated and you say, I can do regular push-ups, that's even better. But wall push-ups are a great place to start. Making sure that you're breathing, and also find a spot where you're comfortable with your legs. The closer you stand to the wall, the easier it is. So remember that. So you can start with your feet pretty close to the wall, and if it starts to get easier, start moving back so you're at more of an angle. And hold the position for 1 second before you return to the upright position, much like our gentleman there is demonstrating. Wrist curls. So you just rest your forearm down on a sturdy chair or like a desk, and hold the weight with the palm up and flex upward and back down. And these should be done with very light weights, 2 pounds even just to start, 5 pounds being probably your at utmost limit. And then calf raises, same thing as before, 3 by 10. And all you do is you start with your feet flat and then go up onto your toes, hold for 3 seconds, back down. Up on your toes, back down. And this is something good to do when you're holding onto a chair or another person, if that other person is sturdy. All right, so other strength exercises, people use little ankle weights. That's fine too. That's when you're starting to progress and you're getting a little stronger. And there are plenty other ones that you feel free to contact us. If you're saying, hey, I saw this somewhere online, I'm not sure if I want to try it, if it's a good idea, we'll give you our email after. Feel free to email us. All right, so now we got balance exercises. So balance exercises prevents falls and maintains independence. It improves flexibility and improves proprioception. Proprioception is the body's ability to sense movement within joints in joint position. It allows us to know where our limbs are in space without looking at them. So that's important. If you ever find yourself in the dark, if you ever just are not looking at your legs and you're making sure that you understand where your legs are and how much you can squat down, stuff like that. Balance exercises should be done most days of the week, if not 2 times a day. All right, so balance exercises. So a good one is just standing on one foot. You should stand with your feet hip wide apart. You should slowly lift one leg off the floor while maintaining balance with the other foot. And you want to hold for 10 seconds. Now this can be 5 seconds to start if you feel very unstable, but the goal should be at least 10 seconds. And then you return to the starting position and repeat with the other leg. This should be done about 3 sets of 10 as well. So if this is difficult, if this is actually easy for you, try doing it without a chair. If that's starting to get easier, try closing your eyes, remembering that you should do this in front of a chair or with someone else, that if you need someone to hold on to, you have them. But once you start closing your eyes, it gets a lot more difficult than you think. So then we can go with the tandem stance. Tandem stance is putting one foot directly in front of the other, just like our gentleman over to the right, so that each foot is touching. You should hold this for 10 seconds. And like I said before, start holding on to a chair, then do it like he is, just freestanding, and then close your eyes. And do that. This might take you a while to get to the closing their eyes stage, and that's totally fine. So then you progress to the heel-toe walk, and that's pretty much the tandem stance, but you walk, and you walk along a straight line. And then when you get good at that, you can do the balance walk, which is walking backwards just like that, and really trying to stay along a straight line. I don't recommend that one with your eyes closed. You might bump into something. So tips to remember when you're exercising: warming up is important. So what we mean by warming up is making sure that you get your body ready for exercise. It gradually increases your body temperature, heart rate, respiratory rate, and blood flow. This helps assist with oxygen delivery. So that's a very important stage. And equally as important is cool down, making sure that you just don't get done with a difficult exercise and you say, okay, I'm done, and go and sit down. You want to slowly get your body back down to baseline. So that's maybe walking a little bit slower towards the end. If you increase time or intensity of exercise too quickly, this can lead to injury. And this is for anyone, any exerciser. So slower progressions are best. Back pain, yoga and core exercises can help alleviate back pain. Don't do anything that irritates your back more. Some back pain might not be related to muscle issues, so consult your doctor with any questions or concerns. Correct form is also very important to avoid injuries. Machines at the gym are great, however, it's still important to know how much weight and to use them before you adjust it. So make sure when you get on a machine, look and see what the weight was beforehand. Just don't grab it and try to pull down. And like we said before, please consult your doctor before starting or drastically changing your exercise routine. They know your disease and your situation better than anyone. It's important that you talk to them. And for more information, feel free to visit the phjAssociation.org/patient/exercise&ph, and that's us over there. Feel free to email us. Our email is super easy. It's exercise@partners.org. And that's Julie and I's email. We share it, so you're going to probably get one of us to respond, if not both. And it doesn't matter if you're not part of our Brigham Women's family. We'll take questions from anywhere.